Great. Okay, well, thanks for inviting me to the class. Um, my name is Carrie Leach. You heard that from your instructor, and I am the program manager for the Center for Urban Responses to Environmental Stressors. The acronym is CURES. But this is my 10th year at 11th year at Wayne State, and most of that history has been spent at the Institute of Gerontology at Wayne State University. So I'll be talking about both of the roles that I play in this presentation: community partnerships for improved public health. So I'm going to introduce you to our team here. You can see Rochelle Chapman. Instead of putting the titles of individuals, I thought I would put our strengths and our expertise, which I think illustrates the diversity of our team, which is really important to be able to address public health broadly. So Rochelle Chapman is our coordinator, and her expertise is in community and faith-based engagement. She just finished her bachelor's at Wayne State University in December, and she has been a great and new asset to our team in 2020. There's my very enthusiastic graduation ceremony picture from 2019 December. My expertise is in health communication, that my dissertation is in health communication, and using community engaged and participatory approaches for engaging individuals in research. And then Dr. James Blessman is a medical officer at the Michigan State Prison System. Dr. Chris Trinacosta here at Wayne State University has specialty and expertise in clinical psychology, child development. And then Nick is our advocacy expert, and he left the Wayne State University School of Law to move to environmental law and policy at Detroit Mercy. And fortunately, he's been able to stay with us, though he holds a position outside of Wayne State University. So a really diverse team. So we have a lot of interesting meetings from a lot of different perspectives. Can I move my screen? Okay, we'll go this way. So I'm going to talk about community-based participatory research principles, community engagement and advocacy, and the impact of engaging individuals, organizations in a research center like CURES. So first, I just want to give a little background about community-based participatory research. So the acronym for that is CBPR. CBPR researchers, here's a quote from an article. CBPR researchers who hope to act on the most important problems in society, such as disparities based on race, class, gender, sexual orientation, or other identities, need to produce knowledge that clarifies and seeks to change unequal distributions of power and resources. And so this is kind of a guiding statement for me in my work, and I'll talk about why, and hopefully you see how we use and leverage resources from the community, and they also leverage their connections with us to improve public health. So there are more CBPR principles that I'm listing here, but these really are the 4 guiding principles that we use at CURES. And I would just caution to say there's a spectrum of community engaged research, from consulting with the community all the way to a very participatory process. Now, in my community engagement role, I draw on these principles, and it is participatory in nature in that we work together with community members to make decisions about how our work looks. And then I've also, my dissertation was very participatory. So the research question came from the community. I worked very close with that community, and I'll talk about that. So just to let you know, there is a spectrum, and there isn't one way to do community engaged research, but it depends on a lot of different things. So you'll see these principles, and kind of I'll sprinkle them throughout the slides and call back to these principles as I present. And so you'll hear these statements over and over and get a fuller understanding about what they mean. So these principles we draw on, recognizing the community as a unit of identity, builds on strengths and resources within the community, promotes co-learning and capacity building. Those are really important words among all the partners, and facilitates collaborative, equitable partnerships and a power sharing process. And so on the left side of the screen, I'm going to talk about my research and it being very participatory to less participatory, but very collaborative and a co-learning process, and my engagement in Detroit to disseminate environmental health information. In my research at the Institute of Gerontology, I'm interested in individuals who are in the late stages of life, who have fewer communication resources than other groups, and I like to call that communication disparities. And then in the engagement in Detroit, we're really targeting low-income families, African Americans, dealing with health inequities. And this year, or at least last year, right, because that was 2020, really focusing on digital injustice. And I'll talk about that as we go forward. So just to give you a little bit of background in my own work, I've been at the Institute of Gerontology since 2008 or 9, and have worked and collected data on a team of individuals that have conducted evaluation and needs assessment. Most of the work that I've done is helping communities, most recently the Monroe County Commission on Aging, figure out how to allocate their funds that they receive through the millage. I was trying to think of that word, the county millage. And we did a needs assessment for that community so they could make data informed decisions based on the actual needs of their senior residents. We use participatory principles to guide that work, and always working in partnership with those communities. And then also communication and engagement. Most of my work is in translating research to community benefit and helping make recommendations and informed decision making. So I just want, I put this timeline on here to illustrate the complexity and the length of time that it takes to engage in a participatory process and research project. So I worked in Monroe County during 2014 and 15 to conduct a needs assessment. And in 2015, we worked collaboratively with that community, did a lot of relationship building and co-developed research instruments, had a lot of in-person phone meetings, email exchanges, a lot of communication to work on disseminating and creating findings and recommendations to improve conditions in that community. And at the conclusion of that, in 2016, those individuals that I'd worked closely with, we had an advisory group of about 9 or 10 individuals, and they said, you know, some of the questions that came out of this needs assessment may be useful to your dissertation, and we would invite you to use our community as a lab, not my words, that was their words, to complete that study if that's of interest to you. And that invite was a real opportunity for me to examine the communication barriers for the older residents in Monroe County to understand what those issues are, and then help to inform changes that could be made to improve those, because we learned there were a lot of communication issues in that needs assessment. So you'll just see from 2015, 16, 17, 18, 19, and even though I finished that research in 2019, it wasn't until February of 2020 that I actually presented the results of that and recommendations to the Monroe County Commission on Aging so that they could make informed decisions and changes based on those findings. And so I just want to illustrate the amount of time and effort and patience when you're doing research that is paired with the community and resulting in an action item, as 2020 is at the bottom of the screen down there. So just to give you an overview of an example project. So now I'll talk about Cures, which Sampson is affiliated with and I'm affiliated with. I work at the community in the community engagement core. The Center for Urban Responses to Environmental Stressors is called a P30 Center. And a P30 Center is a center that is funded by the National Institute of Environmental Health Sciences. And the goal is to understand the impacts of living in an urban industrialized environment that individuals experience living in Detroit. And that is led by Melissa Runge Morris and Dr. Johnson, who is at Henry Ford Health Systems. And we examine both the chemical and non-chemical stressors that people face in their environment. And the goal is prevention through community awareness and public policy change. And you should be able to see also that we are helping to achieve that goal as I give you examples of how partnerships impact public health in a positive way. And so I'll talk about our aims. We really aim to impact the environmental health knowledge and awareness of our partners. We have a community advisory board and enhance the environmental health and knowledge and awareness of community residents so that that information can inform decision making, whether that's an individual living in their home and the decisions that they make about in their everyday lives, all the way to decision leaders and makers. And we do that through sharing and inviting researchers to present their research to our CAB, which is our Community Advisory Board, as Sampson has done, Dr. James Daniel has done in the past. But we also then have individuals researchers come and speak in community forums that occur throughout the city of Detroit, except for this year and last year because of the pandemic. And I'll talk about how we've transitioned to moving from face-to-face interactions and our own adaptation in a time of coronavirus. And finally, I'll talk about advocacy training and tools and how that also leads to improved and protected public health. So just to give you an overview of our partners, there are lots of them. We have a very broad community advisory board. You can look through all of these logos and visit our website if you want to learn more about those. I would also echo what Dr. James Daniel said. I know some of you will be doing projects and may have interest in one of these particular organizations, and I would welcome you to reach out to myself or Rochelle Chapman with the Cure Center, who also is part of the Community Engagement Core, if you want to just talk about, learn more about any of these organizations. I'm happy to be a resource for you to learn. And these are our fearless community advisory board leaders. This is the first time we'll have 3 leaders this year. Really amazing advocates for the environmental health in Detroit. And we're lucky to have Donna Wilkins, Sandra Turner Handy, and Melissa Cooper Sargent work closely with us. We really do integrate these 3 individuals in our center. Not only do they lead our community advisory board, they come and participate and attend all of our internal Wayne State University Cure's leadership meetings, our community engagement team meetings, all of our planning meetings. They really ensure that our center, the work, the community engagement, our communication, health communication, really reflect the concerns that Detroiters face. And they keep us on message, on topic, and inform us when we are off or need to adapt. And I'll give examples of that in the next few slides as well. So as I showed you in a slide earlier, you'll see that I'm referring to some of these aims and circling back to kind of prime you to think about, well, that's the goal, and then I'll talk about how to do that, right? So we want to enhance the health knowledge of our CAB and community members. And this is a great example of how sharing the science in a community advisory board member then also gets into the hands of community decision leaders and decision makers, being policymakers, decision influencers. So in 2020, maybe that was 2019 now, 2019, things have changed so radically. For example, Chris Trinacosta and Tracy Baker attended one of our CAB meetings, Chris presented on environmental exposures, and Tracy Baker talked about water contamination. And what happened on that Wednesday after that meeting, in the center picture there, you'll see Nick Schrock. Next to him is Terry. Next to her is the senator, Stabenow. Terry was at that meeting and went back to her office and talked about what she had learned and phoned us. I think it was the next day or that evening, or it was very quickly, and said, is there any way you could have those presentations given again? I'd really like the senator to come to iBio, hear that presentation again, us talk about how it relates to the policies that she's been working on. And so this was a really exciting outcome of a CAB meeting, having that knowledge really transferred very quickly. And during those presentations, while Dr. Trinacosta and Baker spoke, she asked the questions related to policy. And while the scientists don't know the answers to those questions, you'll see Nick Schrock there, who's front and center in that picture. He was able to respond to those questions about policy, about contamination levels in water when Senator Stabenow asked the question. And that was just a really exciting example of how dialogue can happen from a meeting like this when you have researchers in the room and people from the decision leading and making community all in one room together. And so I just wanted to give that example because it has a great outcome. And on the left there, you'll see in the checkered shirt at the bottom, that's Dr. Chris Trinacosta, who was invited to our state's capital for LED Education Day. And so that happens annually. One of our community advisory board members, Tina Reynolds, asked, after she attended this CAB meeting, asked Dr. Trinacosta to go to Lansing for that event. And so it's a way for the researchers to get integrated in decision leading, decision making circles and bridge those two worlds. So an example of how that happens. Our next aim is to conduct educational forums. And at the top of this slide, I'm calling back to one of the principles, which is we want to recognize the community as a unit of identity. In my research, the unit of identity was Monroe County older adults who are vulnerable, 75 and older. In this case, I'm going to be talking about the unit of identity being by geography. Right, so if I were going to hold a meeting on air quality and connect a speaker like Dr. John Reiners, who has expertise in air quality matters, it might have been that our team presented this research in a specific area. But having our community advisory board come to a planning meeting, we learned, right, that the air quality information that Dr. Reiners presented worked for some people, but not others. So on the left side of this screen, the Near East side, these individuals said, we really want to hear about air quality and the issue around the incinerator. I don't know if you're familiar with the incinerator, which was recently closed, which is just near Wayne State University's campus. But this is when it was still open. And their ask was to focus on the Near East Side in Detroit. And then we also had community members who were in that planning meeting who said, well, we have this concern about diesel emissions. And so in Southwest Detroit, we'd like you to talk about and present maps and air quality data relevant to that concern, right? And so we know and appreciate that there are different units of identity within Detroit. And this is one way that we enact those community-based participatory research principles. And I hope that's a good example of that. But we've kind of thrown all of this out the window too. Instead of disseminating environmental health research this year, I keep calling this year, but this was last year now. Sorry about that. In 2020, we really have had to adapt to community concerns and have relied on our partners to help us do that. We do a lot of listening in our community advisory board meetings. We had made many calls to community contacts to say, right, we can't do face-to-face interactions and forums anymore. How can we adapt to meet the needs, and what are the new needs, if not for environmental health literacy, if we set that aside? And what we learned is people have a lack of access to masks and sanitizer. People ask questions like, can I make my own sanitizer? We can't get things like bleach in Detroit. It's sold out. I can't access hand sanitizer. We don't have masks. And then they also talked about lack of access to reliable information and myth busting, especially in the early part of 2020 when there was a lot of confusing and information being distributed, disseminated. And then the racial environmental injustice was after the killing of George Floyd last year. I was invited to a libation ceremony. This was a first for me, and those are pictures from the bottom. And just showing up for our community advisory board members and reciprocating support was an important effort on our part, having these partnerships. And then stress and mental health plaguing people. This is ongoing, and we continue to think about these social stressors, right? So non-chemical stressors. And so we answered the call, right? So if we're listening and we're honoring our participatory principles, we're working with people and then adapting to those needs, not just meeting, having our own work and agenda, but really being able to be nimble and respond to those, and getting off mission for environmental health literacy, particularly in 2020, to honor those partnerships. So we did deliver masks and hand sanitizer, and develop some fact sheets to distribute in print through various networks. And we adapted an old-fashioned telephone method of reaching people, and that was new for us. We hadn't done that in the past. And so we got on a call for a small group. You'll see on the left-hand side of the screen, that is the Hope Village Revitalization Network, and shared information on stress and coping with that stress. Oh, excuse me. And we also distributed fact sheets to make solutions at home, to manage stress, and to do some myth busting, and distributed 4,500 versions of this in email and in print form. One of our community advisory board members, this is how partnerships improve public health, really said to us, look, you all are getting your information, which is so true, from NPR and reliable sources. And this is not the way and the channel that people are using. There's a lot of confusing information. And so she and they, the community advisory board, really encouraged us to use telephone methods, print methods, to distribute information. And that's exactly what we did. I do have a link there at the bottom of the screen if these are useful to you or any communities practice that you might know, just to share if useful. And so we actually moved all of our programming online, not ideal because we know that about 40% of people that we have interacted with in the past don't have access to computers or email, but we were able to share information throughout the city based on what our community advisory board said we should focus on, which is myth busting around coronavirus, coping with stress, particularly given the racial injustices that were happening this year. stress and coping is something that we have spent a lot of time on, and those resources are also on our Facebook page. I have personally gone back and looked at that stress and coping video myself, although this on inauguration day for us should help. So I did want to I have a brief video to share because I think that it is more impactful to hear from somebody besides myself and one of our community advisory board members, Dell Stubblefield, and she's in the bottom left-hand side of your screen there. Dell is an amazing advocate for her area, which is in the Hope Village area of Detroit. And this is an example of how partnerships improve public health. She came to us about a zoning issue that was happening in her area that she had learned about and said, look, this concrete crushing organization wants to install this concrete crusher, and what will come of this? What will be, how will this affect air quality? Especially because this site that they were wanting to zone or place this was very near to 4 elementary schools, urban gardens and parks. And we actually went and gave a presentation to her and the individuals that she works with so that they could learn more about how to advocate. And so I'm going to play this brief video. I'm keeping wanting to check my clock here to make sure I'm not going too long here. And I think you will be excited to hear more from Dell than myself. This was our community engaged research symposium that we had in December of 2020. So this is very new. You will see our list of community advisory board members here. Our chair that I showed you at the first slide, this is Sandra Turner Handy. She talked about the role of research and advocating for environmental health, and I have that video as well, but I won't be playing that. I'll be playing Dell's video. Her presentation was really illustrative of how she leverages her connection with Wayne State and with Cures to protect the community where she lives. And so I'll let you watch this
participatory research.
Thank you.
Great to hear from you. Thank you so much, Reverend Bailey. Up next, we have Dell Stubblefield. I don't know if she's going to show her face. Dell and I pre-recorded her presentation. If you were with us early this morning at about 8 a.m., Dell gave an overview of Detroit. Welcome to her home, sweet home. If you click on her profile, you can read her bio. Dell is an expert in Detroit. She is a teacher of mine. I have worked closely with her for the last 6 years. And one of the things that Dell is particularly gifted at is community inreach, particularly for the area that she lives in right now. And I have known her as an advocate and activist, worked with her in an intergenerational groups, community presentations, all kinds of ways. So I'll let you say hello, but then I'll play our pre-recorded presentation for everybody. Noel, if you
Good morning. Good morning to everyone. And I'm really, really enjoying this. Thank you so much, Carrie, for inviting me to be a part of it. And I'm learning, I've learned so many things that I can utilize in my work. So thank you.
You're already getting hi, Dell, in the chat. So watch the chat box while we watch this video. Okay, thanks, and thanks, Noel, for cueing the video.
It's a video and a video and a video.
Today, on this Saturday before the symposium, we did decide to pre-record, and I just want to make note of the reason why I thought this was a good idea. You and I have worked together in the past, and we've had instances where there's been internet connection issues. I'm having actually some computer issues myself. But one of the things that has happened, not only in our experience, but we're hearing from other people, is that they don't have access to some reliable technology. We've actually had to drop some iPads off for individuals, and hotspots for different individuals. And we didn't want to have to deal with the internet connection. And you were talking a little bit about the issues you were having with connection, when we talked earlier. And so I thought that pre-recording would be a good way to make sure that we had a reliable, stable presentation. So does that make sense?
That makes sense, and thank you so much for thinking that way. I think I may have felt a little uncomfortable saying to you that I would want to do this, because I wouldn't want to kind of put it out there about the difficulty I was having. But as it turns out, what you are suggesting is exactly what I need.
Okay. Well, I'm so glad for that. And I'm glad that you can be part of this and we can have this conversation. I always enjoy every opportunity I have to work with you and chat with you. And so I suggested to our steering committee that we have a part of this session devoted to community inreach. I think one of the things that is really unique to your experience with Cures over the last 6 years, although I feel like we've worked together way longer than that, was being able to reach into the university through your connections. You're a member of our community advisory board for Cures. And I just want to elevate your experience reaching into the university and how you've done that and then been able to use that in reach for advocacy in your community. So if you could talk a little bit about that, I think that'd be great to hear.
Well, first of all, I want to point out how I was hesitant to remain with CAB. After attending meetings for a year or so, I didn't feel that I was a good fit. I didn't feel that I was getting anything out of it. I felt like conversations were over my head. And I was really thinking about stepping away from it. But after speaking with you and the administrator at Oakland Manor, Deborah Beard, who encouraged me to stay with it, I am so glad that I did. If I had stepped away and not stayed with it, I would have missed out on a great opportunity to have at my disposal and for the community in which I live, opportunities to get assistance and help that we needed on difficulties we were having in the community. Such as one of the times we were having difficulties was in regards to a concrete crushing company that wanted to develop a business in the community. We were uncertain about that. We felt like we don't want this, but we could not really verbalize why we didn't want it. So I was able to reach out to you, who in turn was able to get Brian Smith to assist us and really explain to us the detriment, the possible detriment to the community of having a concrete crushing company so close to the Center for Children and in an area where there were a lot of seniors with compromised health conditions. And we also house in this community neighborhood service organization, and many residents there had compromised health conditions. So we got a really good understanding and a clearer way of expressing ourselves. That this is not what we felt to be a good business opportunity in our community. So you were very helpful with that. And we were able to come together as a community and go through the process and when on 3 to 4 different levels to prevent this business from opening up in the community. And we're really happy about all the help that you and Peers was able to give us.
That's awesome. And was there a specific tool? I think it was air quality data. Was it that you used in that dialogue at community meetings and things like that?
Yes, that was a main component of the information that we got, the air quality, and an understanding that particles from that company could spread all over the community, which is a 107 block area. So it wasn't just about the quality of, we're looking at what could happen to the entire area, to the health of the entire area. And also, we were also informed about the number of cases of asthma and sinus trouble and different breathing problems that could worsen. Another very important factor we found out was a building, Focus Hope, would draw in air to utilize it as part of their cooling system, and they would have been drawing in those particles into the building, which could have compromised the health of over 100 people that were employed there. So it was really beneficial to get that information, to be able to verbalize that information and see the result of having that, at which allowed us to be able to take a stand as a community and have information that we could use as leverage.
Well, I appreciate you sharing that story. I hope that the takeaway here is that there's benefit to these partnerships that we may not readily see, right? That through this dialogue and working together, that people see a way to reach into the university so that they can promote and protect health in their communities.
There's definitely benefit. There's information that you and Curtis was able to supply to this community. Really made the community stronger. It made the residents stronger. They were more knowledgeable and was able to express themselves in a very educational way. And even more recently, we had a situation where there's a new development that's coming into the community, and some of the things that were brought out in the conversation was information that we had gotten before. We were asking this company, what about the air quality? What about the noise? How is that going to impact the community? So had we not had that opportunity to work with you and peers, become more knowledgeable, we would not be as strong as we are as a community, as Hope Village, which is our motto is that we are stronger together.
I love that. And I thank you so much for taking the time to meet with me and talk about your experience. And I'm going to move on to.
That was Dell. I think she says it better. I could say that for her, but when she talks, I love to listen. So an example, right, of empowering individuals to advocate for community protection is one of the ways. One of the things we do. So next, I'm going to you could see how poor that video quality was, and I think most of the people that I interact with, I don't think, through Zoom meetings in a week may take for granted that not everybody has cameras and reliable internet connections. We've been thinking a lot this year at Cures about digital justice issues. So Dell lives in a senior high rise, and while there is an internet connection at her site, she explained it as in it was installed for individuals to use in that building, but not, to have maybe tablets or use a smartphone. But because people have been in their homes for so long, especially those in those senior buildings, people are discouraged from moving about that building. I mean, Dell says to take out your trash, you have to put a mask on. No one else is allowed to be in the hallway. She goes to the end of the hallway, gets rid of her trash and goes back inside. The community rooms are not open. They are asking individuals not to move about. And so the internet is really taxed in that building where she lives. And in fact, that community event or that symposium we were putting on was happening on a work day. And she said, well, I know those are peak work hours. And so we really should record that on a Saturday so that we don't get disconnected, because we also had meetings where she'd fall off or we couldn't stay connected. So we've been thinking about digital justice issues, digital advocacy, especially this is a proposal I wrote as Dr. Schrock came to me and said, look, Carrie, I think we should present at the symposium coming up. What do you think is the central issue we should focus on in 2021? And we wrote this proposal at the end of 2020 and got really clear about our messaging, right? That Detroit is among the lowest internet connectivity in the US. I knew that there was about 40% of people we interact with that have a hard time accessing and getting information from us because they don't have email addresses or computers. But this really solidified for us and validated that this is a real issue. And so digital justice is something we've been talking a lot about in 2020 and as a foundation for environmental health literacy. And so this is kind of where we've moved. And then in November of 2020, someone answered the call and said, we have this surplus grant funding and you have great connections through the Community Engagement Corps. And they offered to provide us with 1,000 tablets. We distributed throughout Detroit to various sites. You can see us in that large picture, moving the tablets into boxes off pallets. This is Focus Hope, into a fleet of vans all over the city. And so this is the first time I've advocated something that's resulted in such a great outcome. And that resulted in about $300,000 in tablets, devices getting into the community, and also about $10,000 in compensation for our community members to do that work with us as well. And so a great outcome, and I just wanted to share that. In the picture there, I saw that one of the networks actually wrapped them as Christmas gifts and then distributed that, and I thought that was really incredibly special. And we also help researchers to know how to translate and talk about their research if they're going to interact with decision makers. So it's another way we can help build the bridge and improve public health. And that is all from me. I am glad that we have about 15 minutes for questions if anybody would like to ask them.
I have a question.
Right.
About advocating for community concerns, do awareness about getting vaccinated is part of the program, or because a lot of people have concerns that even though COVID-19 vaccines are available now, a lot of people have skeptics about taking them. So since this has to be done in next year, are you guys taking measures to make some kind of awareness or a program to support that?
It's a great question. And yes, I've actually participated in one of the slides. You'll see that let me pull up what the actual title of that was. We had one of our events, which was progress in vaccinations. And some of the time that we spent was myth busting around vaccinations. I think this is going to be a huge hurdle. I don't think it's anything that we're going to be able to address, but I think it's going to be an ongoing issue. And I also helped work on a grant related to this issue. I think there's a lot of misinformation, and I'm hoping going forward there will be a lot more reliable and accurate information. I think it's going to be something that we'll be talking at our upcoming community advisory board meetings. Last year was really focused on racial injustice, social injustice, environmental injustice, and digital literacy, but I can see the trajectory going forward, our community advisory board meetings being very focused on just that issue. So are we doing something about it? I assume we will be doing something about it and ask to distribute more information to MythBust on that topic. So headed in that direction, I anticipate anyway.
Okay. Is there any way that people like us, students, can help? Because like I would be happy to involve in, advocating for vaccines, because it's such an important thing. And just looking at numbers from when the vaccine started getting approval, the general statistic was 62% would prefer to get vaccinated. But now when you look at the statistic, it's only 52%. So it's like decreasing instead of increasing. So I just want to know, how can we help?
I will always take help. Be careful what you wish for. Yes, one of the things that we will do, which takes a lot of work, even just creating that recipe for a disinfectant, that was a 2-3 week research project, looking at the CDC. What new information that's really reliable can we translate into very plain language that people can understand? And so if you're wanting to contribute to that effort, do the research, help develop those fact sheets, especially, yes, the answer is, can you help? Absolutely. My email address is on those slides. So yes, please do reach out.
Thank you.
No, thank you. Other questions?